Passing your boards, first day of work, I can definitely imagine both those feelings. Hey, welcome to the OT Minute. My name is Arno. It has been a minute, pun intended, since the release of my last video. So if you're tuning back in, welcome back. I have been on a little hiatus because I've been on a challenging yet awesome fieldwork experience over the last 3 months in an inpatient neuro setting. So to get back into things, I figured why not do a fun and interesting topic today that I think is important and is also one of the key takeaways from my level 2 fieldwork experience. So today I want to talk about the health benefits of laughter and humor and why it's important to OT and how can we perhaps leverage it intentionally to get better therapeutic outcomes with clients. So if you enjoy this video, please drop a like or a comment down below and feel free to share it if you find it interesting or helpful. So in the spirit of laughter and its therapeutic benefits, what better way to get us kicked off than to look at a couple of OT memes. PT and OT when they get their CVA patient to take their first step. Your patient happily discharged home after regaining their independence. That's a sweet one. I like this. That makes me happy. First, let's talk about the physiological or physical benefits of laughter. Humor and laughter are such powerful forces that they actually change the neurochemistry and the physiology of our bodies. We know that generally if an OT is seeing a patient or a client, it's because there's been a disruption in that individual's occupations and they're experiencing a level of stress because of this. Well, the cool thing about laughter is that it has been shown to decrease cortisol levels. Cortisol is the key stress hormone that's involved in our sense of fight or flight. Cortisol is essential to get our bodies to kick in and respond to stress, but it's incredibly harmful if our bodies have cortisol released at high levels for an extended amount of time, and it's been linked to health problems such as depression, anxiety, and cardiac problems, among others. While being in a hospital setting for prolonged periods of time, having chronic health issues can naturally be crazy stressful, which is not good for clients and their health and well-being. Therefore, a little humor and laughter helps clients to relax. Being in a lower level of stress also gives clients and patients access to more of their higher complex cognitive thinking areas in their brain, which is helpful for clients who are working on cognitive training or problem solving or things like that. If a person is stressed all the time, their problem solving and creative thinking will be limited. Pedretti sums this up while stating that laughter facilitates mental clarity, creativity, and brainstorming because the two brain hemispheres communicate better during humor, and the limbic system is also aroused. Therefore, if we want to increase a patient's creative problem solving, we can use humor as another therapeutic tool to decrease their cortisol levels and increase their hemispheric communication to see if it helps to improve their occupational performance. The second point that sticks out to me regarding the research of laughter is that laughter has been linked to improved immune functions via the release of immunoglobulin A and gamma interferon. Plus, laughter is linked to increased levels of natural killer cells, which are important cells that hunt down and destroy abnormal cells. It's crazy to think that incorporating humor and laughter into our therapeutic way of being and interacting with patients, we can actually help boost their overall ability to fight off illnesses. That in and of itself is huge, but not only does the immune system get a boost with laughter and humor, but blood pressure drops, cardiovascular functions improve, and blood flow increases. By incorporating humor intentionally, we can actually contribute to the client's health and well-being while doing other occupational-based interventions to meet those functional goals. Finally, in our discussion regarding the physiological benefits of humor and laughter, we can't talk about the benefits without talking about the release of endorphins that it promotes, which is beneficial for pain relief, and the fact that it promotes release of serotonin, which is an important hormone that does a lot of things, but most notable is that it helps us regulate our moods. Therefore, laughter can also be a therapeutic tool that we use intentionally with clients who have pain and perhaps even some mood dysregulation. The best thing is that humor is free and laughter does not cost you or the patient anything. That brings us to the OT question of the day. How have you seen humor and laughter be helpful in your therapeutic interactions and experiences? Now let's move on to the second realm of benefits of laughter and humor, which is the psychological and psychosocial benefits of laughter. There are 2 points that I want to reflect on here. Probably the most obvious psychosocial benefit is the fact that humor helps people build rapport. This has been important in nearly all of the settings that I've been in. I know that kids want to have fun and be silly and laugh, and it's a key indicator that they're starting to trust you in that therapeutic relationship and are engaged in what's happening. Also, I have found that in inpatient settings, humor helps to break the awkwardness for patients who may feel vulnerable or self-conscious. I particularly love laughing at myself because you can kind of see how people's guard just comes down as that you begin to build that rapport and that bond and show that you are relatable and not necessarily coming from a higher tier level looking down at them, but you're really there just to be a support, a help, and then to be a guide maybe in the therapeutic process. Humor is also a valuable attribute in helping to distract people from their negative thoughts and negative thought patterns. Together, this can help people build resilience and endure challenges. And let's face it, therapy can be fun, but sometimes clients are worn out and at the brink of giving up. And it takes a lot of resilience for them to push through these times and circumstances. What I love about OT is that OT really values the importance of mental health for patients and the reality of the human experience, which is riddled with joy, sorrow, and really anything in between. Fortunately, we have some proven tools that can help people push toward occupational engagement when they get stuck in some of those negative thought patterns or find themselves overwhelmed and unmotivated. Traditionally, this can include mindfulness, cognitive behavioral therapy or CBT, and motivational interviewing, among many others. However, research indicates that humor is also an effective tool to help patients cope. So we can add that to our therapeutic tool belts as well and use that in conjunction with some of the other therapeutic approaches. The OT after 2 refusals. I'm back! Now, in talking about the benefits of laughter in therapy and incorporating that into our therapeutic use of self, I think there's also a couple things that we need to keep in mind, and this is in many ways from my own experience and just what I've seen works and what doesn't work. And the first thing to keep in mind is that humor is subjective. Our values, beliefs, worldviews, and experiences all influence what we think is funny. So humor can just as easily build rapport with somebody as it can offend somebody. So keep that in mind when selecting the topics that you joke about or the stories that you tell. I think that's why getting to know our clients well via the occupational profile or occupational interview is super important. And just on a personal level, I also think it's probably wise to, in general, stay away from topics regarding politics or religion, just because those topics carry so much emotional weight for people and can derail treatment sessions really quickly. The second thing that I try to keep in mind myself is that humor can also be counterproductive. I found this to be true with patients with neurological deficits who are already having trouble doing 2 things at once, either to impaired divided attention or impaired alternating attention. So adding a lot of conversation, even though it's fun conversation, can actually detract from the treatment sessions. The third thing to keep in mind is that humor and laughter can also be an avoidant behavior. Sometimes people will joke and use humor to try to mask mistakes, avoid being in a vulnerable place, or to completely avoid doing certain tasks or tasks that they might be intimidated by. It takes us being on our game and recognizing these avoidant behaviors and knowing how to shift the conversation and focus of the therapeutic relationship back to the task and the goals of the session. Personally, I expect this from kids because I see my oldest do this all the time. For example, he may avoid cleaning his room or getting ready for the day by being silly or cracking jokes, which is typical, but I don't always expect it with adults. So I think it takes a little bit of a keener eye to recognize adults using laughter to avoid certain tasks or activities. Now, the fourth thing to keep in mind is that not all humor is the same. There's a study that surveyed 500 internet crimes against children task force personnel regarding the use of lighthearted humor and darker, more negative humor to see if it helps them to cope with the secondary traumatic stress related to the traumatic nature of their jobs. The study concluded that lighthearted humor is definitely recommended to be used for promoting group bonds and cohesion, and also just to decrease stress in general. While dark humor can also do these things, too much can actually be a sign of what they call pent-up frustration and can actually have negative effects on other people's psychological well-being. Therefore, keep in mind that negative or really dry, sarcastic humor, when unchecked, can actually be a bad thing. It can also be an indicator that we might need to kind of check ourselves, make sure we're in a good place, dealing with the pent-up frustration so that we can be individuals who bring joy to those around us and not this sense of negativity masked in humor. So I hope this has been helpful and interesting. I know that it has definitely widened my appreciation of humor and laughter and its place in occupational therapy and therapeutic interactions. If you like this video or want more content like this, don't forget to subscribe, turn on the notification bell, and I'll see you in the next video.
Did you ask me here for any specific reason?